morning, Isabelle.
Today, we're going to be talking about what we wish we knew when we were just starting out as therapists.
Yes, I think this is a topic that most people listening will be able to relate to. And I think there are a few things that I really wish that I'd known when I started out. But I think the most important thing for me, and something I really try and instill in the supervisees that I support at the moment, is that the therapeutic relationship is the most important component of this work. And that has been shown through research for over decades and through several different studies. And so starting out with that, being present, being available, and sitting and listening and using those basic counselling skills that we're taught. Normally we're taught these at uni. And using these skills in the room is a really, really good way to start.
Yes, Claire, I 100% agree with you on this. When I was thinking about this episode today, it was actually the first thing I thought about, remembering what it was like starting out working with people in that psychological space, sitting with clients in a room by myself. All of a sudden, it was me responsible for doing the therapy thing. And I do wish that I had have known back then that just being with a client, listening to them, using those micro counseling skills, listening and reflecting, validating how a person is feeling, that is good enough.
Yes, yes, it's that holding space, which is the client is presenting to us, usually with some level of distress or needing some support. And I think our first to hear them,
Yes.
and to listen.
And that is what will help develop that therapeutic rapport, that alliance, that relationship in the early days. And research, as you said, tells us that that's the most important component to therapy and to helping our clients to experience improvement in their well-being if they feel like they can be heard and listened to by us.
It is. And I think there's so much pressure for us to have all of the interventions, all of the strategies, and to give our clients something to take away with them, that sometimes we forget that actually just our presence and the client having that opportunity to just talk about what's on their mind in a very different way, a one-sided sense, in the sense that we are there really very much to be receptive to their experience and reflect on their experience, is actually something we can give them.
Yes, most definitely. Now, this leads to another great point that we wanted to share with everyone today about what we wish we knew. You mentioned about having that pressure to deliver interventions and send people away with skills and knowledge. In fact, there is a great shortcut that I learned when I was training to use manualized interventions. Claire, can you also relate to this?
That's exactly how I started out. I was given a manual. It was supporting people who had were experiencing agoraphobia, and often were really struggling to even venture much further than their front door or to appointments. And I found it was so incredibly helpful in giving me a structure, but everything was laid out, so I didn't have to, I guess, develop or formulate that intervention myself at a point in my career where I don't think I really had the skills and the knowledge to be able to do that. So having that laid out in front of me and having that structure was a really, really helpful way for me to start.
Fantastic. So, a small tip for anyone who is just starting out in the therapy space: there is a website in WA funded by the government there, and it's called the Centre for Clinical Interventions, CCI for short. So, if you're wanting to look for some great evidence-based, usually CBT-based interventions, available on the website. So please go and check them out.
They've actually got a range, I believe, of different types of programs for a range of different presentations. And as you say, they're free to download. I believe that website also has a number of other worksheets and psychoeducation booklets that can also be downloaded, that can be also incredibly helpful, because we don't always want to reinvent the wheel. And if we can find somewhere where that information is laid out for us, it can be very helpful, particularly in the early days when we're providing some psychoeducation. We're just learning that information ourselves, so it is
That's
okay.
right. Yes, yes. And that's what I loved about it as well. I was learning while the client was learning.
Yeah, and it's okay to do that. It's okay to do that. The clients know that we are, at the beginning, if we disclose that we're provisionally registered, they know that you're in training, and it's okay to occasionally be, reading the information out and providing the information in a format that is both helpful for your learning, but also the client's going to learn from this too and find it helpful.
It's so wonderful to normalize this for everyone who is listening.
Absolutely. And it's fine to use these shortcuts and not have to develop all of your own resources. Over time, you might begin to, but it's okay not to have to, feel like you've got to, really start from scratch, developing everything yourself, because there's a lot that's available and freely available.
Most definitely. Oh, that's lovely. Well, there are a couple of other things we wanted to share with everyone today. One of the other points that we were brainstorming for this episode was something that we felt quite strongly about, and that is that all of us, all therapists, whatever profession you come from, whatever training you come from, we're all going to be slightly different. And when we're training, especially if we're in a learning environment with other therapists who are students, it can be really easy and sometimes unhelpful to compare ourselves with the others that we're learning with.
Oh, that's so true. That's so true. That sort of comparison-itis, I know that's not really a word, but I think we're all familiar with what that is. It's sort of almost ingrained in us. We look at what everyone else is doing and think we should be at that point. I should be learning this.
I should be doing it like that, or yeah.
Yeah, and even sometimes your supervisor may have a particular way of doing things, and you may put your own slant to that too. I mean, I'd be very happy for my provisional psychologist that I support to take away anything that I would provide them with in terms of support or guidance, and to put their own slant on that. But I think initially we often do rely on that structure. And so, I'm not saying that you have to go out there and reinvent things and do things in your own way, but I think that, we are going to bring very, very different things, and we are not going to be alike. And that's partly what our clients are going to, I think, come to us for, the relationship that we provide and the connection that we provide, which is going to be unique. Every single client that you see is going to feel very, very different. That's certainly my experience. And so not sort of falling into that trap. The other thing is particularly around the internship, where there's so many tasks to complete, and just sort of keeping up to date with what everybody's doing.
Yeah.
We all have very different commitments in our lives. Some people are working part-time, some people are working full-time. Just knowing that you'll get there in your own way. We don't need the pressure from others telling us, ideally, how we need to be doing things. I would really encourage you to be doing things in a way that really aligns and works for you.
Yeah. That leads in nicely with one of the other points that we wanted to share with our listeners today, which was around practicing some of the interventions and skills that we are delivering. I do remember in the early days, if I was trying to deliver, say, a mindfulness skill and teach someone how to do mindfulness, or maybe even some of the CBT journaling strategies, I found that it could be a bit awkward if I hadn't had a go of doing it myself, if I didn't know what it felt like to be, I guess, on the receiving end of it. So encouraging our listeners to consider practicing some of the things that they're teaching.
Absolutely. Yes, because I think that when we're asking a client to do something, if we understand the benefits for ourselves, I think we're going to explain it and explore it with much, much more conviction.
Yeah,
We're going to have a lot more confidence in what we're offering, knowing that it actually is beneficial,
yeah,
but also knowing some of the setbacks. When somebody, like talking about mindfulness, and I hear people say, I'm sure we all hear people say, "Oh, I'm not very good at mindfulness. I find meditation really difficult." And
mm,
I think the reality is that we all find meditation really difficult. It's not
yeah,
something that's necessarily that easy, because the mind does wander, and that will happen. And I think when we have that experience ourselves, we can normalize that much more for our clients
yeah,
and say, yeah, it is hard, but with practice, and is it something that you would be interested in trying? Because and giving, not necessarily saying that we have tried it ourselves and disclosing from that perspective, but in being able
mm,
to say, this has been shown, or research has shown, that practice in these things can be beneficial, and
yeah.
being really confident in ourselves that can be the case.
Yeah, yeah. So even if we're not disclosing that we practice it ourselves, I guess the way that we come across in our both our verbal body language and our non-verbal body language, I think our clients are quite good at being attuned to when we're being authentic or not, when we really genuinely believe not just that the research tells us that this works, but we have had that experience. So the feeling is different when we're conveying that to our clients.
Yeah, yeah. I think one of the other things that's really important around practicing what we preach is that often we're trying to support our clients to develop really, healthy boundaries. We're encouraging our clients to really look after themselves and, really focus on their self-care and their own needs, and perhaps be aware of any sort of self-sacrificing type behaviors. And
Mm,
in that respect, I think it's also really important that we can begin to model some of that ourselves with our own healthy boundaries, which, as we know, is not always that easy to put into place. But it's so important, I think, that we model this, because when we are talking to our clients about, say, putting boundaries in place, sometimes we can relate to those struggles as well. And again, our own
mm,
experience can begin to inform maybe how it is so hard to do these things. And so it gives us a lot more compassion and more empathy, where we could say to a client, it is hard. These things don't come naturally to us.
yeah.
I see this is something you're really struggling with. And yet we don't deviate from that, because we're obviously, that's part of the goal and what we're trying to support the client with. But I think if we really truly understand what we're trying to support our clients with ourselves, we're going to do a much better job of that.
Yeah, I agree with you there, Claire. So I think a couple of those points are really valuable, just around being mindful that it can be useful for us to
Yeah.
have a go at what we're delivering in our intervention sessions,
Yeah.
and being mindful about boundaries and taking care of ourselves. And I think we've summed that up quite well.
Yeah, one of the other things, points that I think is, that I wish I had perhaps realized a little more when I was training is, we do all experience some level of anxiety when we first go into something very new. And to some extent, that's actually quite common and quite normal. And in some ways, it also tells us that we are taking this really seriously, that we're wanting to do a really good job. And
Mm, I
some
can
people,
relate. I can relate to that. Yeah.
yeah, yeah. And what was your experience of that?
Oh, well, I guess for me, it was feeling overwhelmed, feeling insecure, or just not confident about what I was doing. Um, but then I guess not letting that stop me from approaching and from moving forward with my learning and my training. I think when you've got some good supports around you, it can help in that experience. So I had a couple of lecturers that I felt like I could reach out to in a safe way, that they were safe people. And I would just kind of go to them and go, oh my God, I'm feeling all of this stuff. And they would offer some words of reassurance and let me know this is normal and it is okay and you're going to be okay. And that was really helpful.
Yeah, I mean, accessing that support is always so helpful and important. And I think that also ties into the fact that, yes, we are going to feel, it is normal to feel anxious and a little uncertain when we first start something very new. That's actually how we all start off. I mean, that's how I started off. You're giving your experience, so that's how it was for you. And every experienced therapist started at the very beginning, which is
Yeah.
exactly where you're at right now. We all had to start somewhere, and we all had to start with not knowing as much as we know now.
Yeah.
And I think we can forget that. We can forget that we sort of look at people with experience and think they've always known this. Forget the struggle that it might have taken um, to get there, or the challenges that they would have anticipated along the way to get there.
Yeah. Yeah. And along these lines as well, thinking about when normal anxiety, when normal feelings of overwhelmed are becoming something that need more support. So I think that was something else we wanted to share, is just around um, similar to practicing what we preach, reaching out, and that it's okay for you to take care of your own needs as well. So at what point do you need to access extra support, talk to someone about how you're feeling and what's going on?
Yes, absolutely, because it's differentiating between, those niggles of doubt and that very normal sense of angst when we are doing something new. We're all going to usually feel a little bit nervous, and that is, I think, normal and that is common. But when you use the word overwhelm, when it
Yeah.
feels as though it's consuming, when it feels as though it's all too much, then that probably is a sign that it maybe is a bit much. And that support is needed, or potentially some kind of change is needed as well, because coming back to that point about us all working quite differently and not necessarily comparing, we all have different capacities for learning. We are all
Yeah.
going to have, different a different capacity for taking in information. Some of us are going to be able to see more clients than others. I mean, there's no sort of hard and fast rule around how many clients we should be seeing, but I see such a variation in placements. Some can be 3 to 4 sessions, some can be up to 6 to 7 sessions, and clearly there's a huge difference there. And I'd love to see some kind of standard brought in where it was ideally around 4 to 5 sessions.
Yes.
Doesn't exist yet. And so, again, comparing somebody who's seeing 6, 7 clients to someone that's seeing 3 to 4, there's going to be different levels of overwhelm. And sometimes, being very attuned to what is enough or too much for you, for your own nervous system, sometimes does warrant a change as well, because I'm not sure I would have been able to work in a job for 2 years full time and completing an internship where I was seeing 7 clients a day. And so just being mindful around expectations and demands, I think, can be, if you are feeling it's too much, possibly it is.
Yeah. Yeah. So really looking after ourselves in those early years. Yeah.
Yeah,
Yeah.
yeah.
And that it's okay to put your hand up if you need help or need to make a change.
It is, because we are not always modelled those boundaries and that self-care, because we're promoting that we would like to be modelling that for our clients, but not always modelled that in the workplace. And so we begin to compare ourselves to what we see others doing or what the expectation is, rather than tuning into what potentially might be right for us. And seeking support from others can often provide some validation around that too.
Yeah, yeah, most definitely. Oh, okay. Well, this kind of leads into one of the other points that we wanted to share with everyone, something that we wish we knew about when we were starting out, which is talking about vicarious trauma, and then a bit about burnout. And Claire, I think I really liked some of the ideas that you had around these topics. What do you remember from you when you were starting out? And what did you wish that you knew about vicarious trauma and then burnout?
Well, what I remember when I started out, that it just wasn't mentioned
Mm,
at all. I don't remember any training at uni around vicarious trauma. I don't remember any discussions in the workplace around vicarious trauma. And my very first experience of what was probably, thankfully, a fairly sort of mild experience of vicarious trauma was I came home one afternoon, and at that time I was living in a house with a number of other people who actually asked me if I was okay and whether they knew that I worked in as a psychologist, and they also knew I worked with clients who had presented with trauma. And just asking me if I was okay and if maybe some of the work might not get to me sometimes. And it was really interesting because I think I'd got home that particular day. I had done an assessment with an extremely complex case. And so it was an interview, and I'd written a report. And the content was extremely graphic and quite traumatic. And I
mm,
hadn't made the connection between I felt tired, I did feel overwhelmed, but I wasn't aware that I was presenting any differently. And
wow. Wow. Isn't that interesting?
it was other people that noticed I was probably subdued or quiet. And then I submitted the report to my supervisor at the time, who called me and said, "Would you like to debrief on this case?" And that had never happened before. It's because
Mm,
content um, was so explicit, graphic, traumatic.
mm,
They had picked up on it straight away, and so I was
mm,
offered that debriefing. And that was when my first exposure to, I think, vicarious trauma personally, but I still
mm.
didn't have a name for it. And I was fully registered.
When was it that you learned about that term, vicarious trauma? Do you remember?
It was when I started doing some training in trauma, because although I had worked in trauma and I had the trauma-informed CBT training,
Oh,
it was very much focused around working with the clients. And there wasn't any emphasis on the training that I had, because most of my work was assessment based as well. And so it wasn't, I didn't get into more in-depth trauma treatment training until a few years post-registration. And so I
so so it wasn't until you had purposely gone out and sought training in treating trauma that you learned about vicarious trauma and then were able to make the connections about that experience that you'd had.
Yes, because the basic training that I had not covered that, which it was a very basic CBT style training that I had, and it did cover trauma, but most of my work was assessment based. So I was very much trained in interviewing and writing reports. So yeah, it was a very interesting experience for me, and validating to get the support, but not really having that explicit education on that, because our clients can present with all kinds of
Mm.
information, all kinds of scenarios and distress, and essentially we could be dealing with trauma at any point, whether we're explicitly trained for that or not.
And that's right. And I think that's something for anyone who's listening today who is just starting out in the therapy space. We may have some wonderful people who are screening, doing intakes for us for the clients that we are going to be allocated. but we don't always know all of the information from those screening or intake processes. So it can, and it's very likely will come up with the clients that you are meeting in these early stages of your career. So I think that's such a valuable piece of knowledge to share with our listeners today, so that you can be prepared and understand, oh, this is that thing that Claire was talking about. And then from having some awareness and knowledge, you can then seek the support that you need to talk about it and debrief whatever it might be.
The other thing I think is also it's mentioned sometimes in trainings, in that we need to look after ourselves and be aware of that, but how we do that is not always explicitly stated either. And so there is this,
Right, yeah.
yes, we've got to listen to our needs, we've got to look after ourselves, but how we explicitly do that is not always very clear, because the focus is so much on treatment, not us.
So if you had a couple of suggestions, what would they be, Claire?
Well, I think it's around looking after ourselves first and foremost. I mean, I always go back to that, such a cliche, but that oxygen mask analogy where, the mother has to put their own mask on before they attend to their children. Because if we are
Yeah.
not supported and looked after ourselves, it's very, very difficult for us to support our clients, sometimes with quite a severe level of distress. We are taking on a lot we're taking in a lot of content, but we're also really taking in quite a lot of emotion and distress. And it's really important that we look after ourselves in order to be able to manage that. And that's going to look different for different people. I'm not sure there's a manual for that.
I have an idea, just something that I've found helpful for myself, that it's taken time to develop this. I certainly didn't do this in the very early stages of my training. But as I've become more experienced, what I've learned is the importance of having activities and hobbies that are completely separate to who I am as the psychologist. So having, I guess, a different part of my personality, a different identity outside of work that fills my cup, so to speak, my emotional cup, and helps to, I guess, give me a completely different set of experiences, a different, more hopefully joyful experiences, where that I can look forward to and think about at the end of a long working day. I can look forward to the day when I get to do the activity that I've planned, and be excited about that. And especially if I'm having trouble switching off, say if I have had a bit of a heavy day where I've had a client share some traumatic experiences with me, it's a bit of a mental strategy that I use to, first of all, notice that I'm doing that switching off from my day of work is hard, paying attention to that, and then making the mental choice to switch into Isabelle, who's not the psychologist, or whatever, and whatever that might look like at that time of year, because I can get into a lot of different hobbies.
Yeah.
This being one of them. But yeah, so that's a practical tip, that, like you said, Claire, not everyone is going to have the same strategies that will work for them, but just an idea of how you can start to create practices that are organic and authentic to you.
Yes, because everyone is going to be so different. And so it is about, are you the sort of person that needs to be around people? Are you the sort of person that needs to be active? Or are you somebody that needs to go home and have some quiet time? Is watching a movie or some kind of sitcom that's very light going to be, your way of switching off at the end of the day? And tuning into what your needs might be, because it's going to be different. But it is, as you say, the life outside of being a psychologist, because it's so important that we do have something other than this work. And most of us, hopefully would definitely have that other life. And it's working out individually what it is going to work for you. And I find sometimes that I'll get home and I'll want to go and do some kind of exercise, my body will really want to move because I've been
Yeah.
sitting still all day. And I find that that's a very good sort of release for me. Other times I just want to come and sit still and just tuning into whatever it is that is going to work for you. But I think the most important thing is about being aware that in these emotional responses that we have are in a way part of the work that we do.
Yeah.
But when they become extreme, listening to those warning signs, because we don't want to reach burnout point.
Yeah. And
point.
paying attention to what our family and friends are reflecting to us as well. So if we do have someone who cares about us, asking us, "Are you okay?" That if we're not paying attention or able to notice that ourselves, listening to those other voices, or from the people in our workplaces around us who care about us.
Yes, because sometimes we hold it thinking that that's the norm. Necessarily. To some extent, it's like that anxiety, that sort of if we think about it on a sort of scale, this mild level is normal, and most of us are going to have some level of apprehension and nervousness at doing something new. But when it's sort of hitting this higher level, and it's time to maybe take stock and get support.
So what we're talking about here is essentially burnout, isn't it, Claire?
Yeah.
Yeah, looking out for the signs of burnout, and self-care, really joyful, practical self-care that, if it works for you, has nothing to do with psychology or providing therapy, counseling, social work, whatever it might be. I think there's some suggestions that we really want to send home with everyone today.
Yeah, and also using supervision. I think supervision can sometimes be a form of self-care. Yes, it's about our clients, but our response to what's happening in the room and helping us be present for that is sometimes appropriate for supervision.
And I will just remind everyone about that debriefing part that you spoke about, Claire, as well. So if you do have a client who's disclosed some particularly traumatic experiences, debrief with someone as soon as you can. That would be a big recommendation that I've learned from my end as well.
Yes, because anybody that's worked, and we've all generally come across these types of cases at some point, even if we're working at, say, a sort of a milder end maybe of the spectrum of presentations, that if somebody does come to me and say, I've just had this day, or I've just had, can I talk? They'll get it. They'll understand exactly what you're going through, and they'll be very willing to support you. Because ultimately we want our tribe of of supporters here.
Yes. So when we're saying debrief with someone else who's in the profession,
Yes.
who's bound by the same confidentiality and ethics that we are bound by. So in your own workplace, your supervisor, or outside of your workplace, but within the same profession.
Although it's okay to tell friends that you're feeling tired, and those things, but it's the content that's very hard to manage outside of the profession.
Yeah. My family members have certainly become very good at we've all become very good at communicating if I've had a heavy day or if I'm having trouble switching off. And there are certain things that we'll do at home on those evenings or even weekends following, that we know are just going to help me to take care of my needs. And that's become a really helpful practice as well.
Yeah, it's so important that you've actually found something that actually really does work for you.
Yeah. Well, thank you, Claire. Hopefully this has been helpful for everyone who's listening today. And we will see you next time.
We will. See you again. Bye.